Hey there, this is Dr. Leslie Allen with the Center for Holistic Healing and the founder of the Overcome Autoimmunity, Regain Your Health program. And what I want to talk about in this video are some different myths surrounding SIBO, small intestinal bacterial overgrowth, and some of the things that are really important to consider when actually going through a SIBO cleansing technique. So, first of all, most people will assume with small intestinal bacterial overgrowth that the bacteria is a bad bacteria. And oftentimes, this is not the case. Usually, it is our good bacteria, lactobacillus and bifidobacteria. Now, the problem is that this bacteria, it's supposed to live within the colon, within the large intestines. But what can happen is this can migrate up into the small intestines, where then it begins to prematurely break down and ferment the food that we're eating and digesting. So we can have hydrogen producing small intestinal bacterial overgrowth or a methane producing. And so it's very important if you are suspicious that you have SIBO, that when you're doing your testing that you choose a lactulose breath test in order to determine exactly what type of SIBO you're dealing with. So that way you know your course of treatment, because these two can be very different based on the different types of SIBO. So what would be some indications that you have SIBO? Some of the, with my clients, some of the number one signs that I kind of look for to make sure that we don't need to do more testing to rule this out is if they report bloating, especially when they report it like immediately after they eat something, their stomach bloats. And oftentimes, another indication is when they tell me, it doesn't matter what I eat. One day it will be one thing, the next day it will be something totally different. And maybe they eat that one thing on, one day, but then the next day it causes bloating. That is often a telltale sign as well. A lot of distension, a lot of gas, a lot of upset stomach, and it will really be random based on what they're eating. Now, another great way to kind of maybe sort out if you need to be tested for SIBO is when you go on probiotics or maybe a prebiotic or a fiber supplement or something like that, and it has the opposite effect for you. So, most people, I used to get jealous of these people because I was the type that when I would do a cleanse or I would take really high quality probiotics, they would often cause more constipation. So if this is you, then that may be a great indicator that you actually have SIBO. And SIBO can wreak havoc on your gut. Not only is it digesting and fermenting foods early, so you're not getting that adequate digestion and absorption in the colon, but then it also contributes and increases your risk of things like leaky gut and inflammation, higher levels of oxidative stress, and other processes within the body. Now, a lot of times what I will also see with my clients that have SIBO is that if they have a Clostridia strain of SIBO, it can actually eat up the building blocks of their neurotransmitters and their hormones. So let's say you're borderline low with your thyroid levels and just your hormones are all within normal range but a little off. You feel fatigued all the time. You're having all the classic signs of a hypothyroid situation. It could be that you have SIBO. It's eating up the phenylalanine, which is a building block for tyrosine. So maybe it's not that your thyroid is not producing enough thyroid, but that thyroid hormone, but that it doesn't have adequate building blocks to actually make the thyroid hormone. So these are important things to consider. Now, if you do have SIBO, then what, right? So you test positive for either a hydrogen or a methane SIBO. What I can tell you is it is typically a fairly complicated process to actually rid your body of SIBO. I'm personally not a huge fan of using antibiotics. What the research will tell you is that you will have a higher reoccurrence rate with the use of antibiotics. So working with a skilled provider, a skilled functional medicine doctor who can help guide you along that process is going to be critical to set you up on a meal plan that is appropriate for you. So we want to make sure that we're eliminating very certain food groups in order to minimize the amount of food that we're providing the bacteria that's in the small intestines, to minimize the fermentation process. So we also want to make sure that I prefer the use of botanicals or herbals in order to get rid of the bacteria that's living in the small intestines. Actually hold probiotics, so you don't want to take your probiotics, and when you do reintroduce probiotics, which is typically a month after being on a pretty rigid diet. I'm not a huge fan of a rigid meal plan, but this is a case where you need to really eliminate the foods that are fueling the SIBO situation. And while you're doing that, also that kind of that die-off process for the bacteria with your herbals. After that point, within, sometimes the 2 to 4 week mark, you can begin to reintroduce soil-based probiotics. So this is something that can be researched online to see, which brands are best. But a soil-based probiotic is oftentimes preferred to really make sure that you're populating the colon and not the small intestines. So I'm going to do another video about pH levels because that's a whole other topic, and oftentimes the pH of the gut drives a lot of the microflora or the diversity that we have living in our gut, or the lack thereof. So we'll save that topic, check out my other videos, and you can find that there. All right, have a great day.